For immediate treatment, you would use salt taps. So you would see the injury occur, ask a casualty what is wrong and where they have pain, look for signs of bleeding, inflammation, swelling and redness, touch the injury for signs of heat, tenderness, loss or change of sensation and pain, active movement, so ask the casualty to move the area if possible and look at all the range of movement. Passive movement, try to move the injured site only if a good range of movement is possible, and strength if no pain during range of movement. You would use salt taps for sprains and strains, bleeding, broken bones or fractures.
So sprains and strains are common types of injury that affect the soft tissue around the joints. So there are three things to look for when dealing with strains and sprains. Firstly, pain and tenderness, difficulty moving, and swelling and bruising. So firstly, you'd use the salt taps, which has previously been explained, but also price. So you'd protect the injury. So you'd stop using the injury and limb, and you'd raise it, and then you'd rest the injury. Then ice would be applied once it's been raised, and then you'd make it comfortable. So you'd put it on a chair, which is about to happen in the video, and then you'd elevate it to reduce the swelling, and wait for further instruction from paramedics.
If a casualty gets a bleed, you would try and control bleeding quickly, otherwise they may develop shock and become unresponsive, and you must always ensure that the airway is kept clear if the bleeding is from the nose and the mouth. So first of all, you would start by using salt taps, as explained earlier, and to treat a bleed you would put on gloves to protect both people from infection. You remove all clothing from around the wound and don't pull out anything from the wound. Apply pressure either side of the object if there is one, or directly on top of the area if it's clean. You'd call for help, and then you would use a bandage to maintain pressure but allow circulation. Once the bandage is applied, you check the circulation by squeezing an area of skin for 5 seconds and release if the blood doesn't return within 2 seconds, the bandage is too tight. If the blood goes through the bandage, do not remove it and apply another. Once you have finished treating the casualty, you would remove the gloves carefully and ensuring there is no blood left anywhere.
A break or a crack in the bone is called a fracture. Closed fracture is when a bone is broken inside the skin. When someone has fallen over and broken or fractured a bone, you have to quickly go over there and analyse to see if there's any swelling and bruising, to see if he has any difficulty moving, and look to see if the shoulder looked twisted or bent. Then you have to check and listen to hear any grating noises when the person is moving the limb. And then you have to see for signs of shock or loss of strength. You support the injured limb to stop it from moving to help decrease the level of pain and prevent the potential of any further damage. You put the arm in the sling and to keep it supported, and if it was an open fracture you would apply dressing and a bandage, and if they are unresponsive you'd put them in a recovery position and be prepared to treat. As you're putting the sling on, before you put the sling on the injured person, you would ask someone to call 999, and you would do price and sort out. For minor head injuries, you'd need to look for unresponsiveness, scalp wound, dizziness, or loss of memory. To treat the injury, you need to sit them down and give them an ice pack for the head. But for severe head injuries, you need to look for unresponsiveness or deteriorating level of response. Leaking from the ear or nose, unequal pupil size, then check level of response to see if they are alert. They can talk if they are in pain and unresponsive. Call for medical help on 999 or 112.
If they're unresponsive but breathing normally, they should be placed into the recovery position to help maintain the airway. So firstly, you'd kneel down on the floor with them and make sure both their legs are straight. Then take the arm nearest to you and place it on a right angle to the body with the palm facing upwards. Then take the other arm and put it across the chest and place it back, and place the back of their hand against the cheek nearest to you and hold it. And with the other hand you'd lift the furthest leg away to a right angle, and then holding both knees and the hand you gently roll the patient. And once this is done, you'd adjust the top leg so it's at a right angle, and you'd turn the head back to let the airway be clear and let the air in. If they stop breathing, then CPR may be performed.
If the casualty is unconscious, then you need to perform CPR, even though this is not what was demonstrated during the video. Firstly, call for help, ask them to bring in AED, then perform chest compressions. Interlock the hands and push down 5 to 6 centimeters and give them 30 chest compressions at the rate of 100 to 120 beats per minute. After 30 chest compressions, you need to perform rescue breaths if you are trained. If you are not trained, then you can continue with 30 more chest compressions. Give 2 breaths once the airways are open if needed or unresponsive, then continue chest compressions till emergency services arrive.